My name is Dr. Alan Dennis. I'm one of the senior physicians at Advanced Pain Care. I practice anesthesiology and interventional pain management. So how I got involved in pain management is a kind of an interesting story. Growing up, I had lots of friends, family members that suffered some sort of injury, and what we saw was not just their path through recovering from that injury, but what happened to them for years afterwards and how it affected the family and so forth. And I knew that's part of what drove me into medicine and what I wanted to do. While I was in my residency, my wife actually worked for the business office of the medical school. And she went out to tour and help consult with the pain clinic at the time. And we had several of the preeminent names in pain management at Texas Tech at the time there. And she told me the story and she got home. And if you just indulge me, it's an amazing story. She was watching in the post-operative area a nurse that had a lady that just had an injection done. And said, "No, go ahead, you can put your shoes on, bend over, put your shoes on." "Sir, I can't do that. I haven't been able to do that in years." "Just try." And she bent over and put her shoes on and began to just bawl and cry. And my wife went up to her, like thinking that he had just hurt this poor woman. And she says, "You don't understand. I have a 3-year-old daughter at home. I've never been able to pick up my daughter. And today I can." So imagine the changing a life and what that means not only to that woman, but a daughter that all this little girl wants is to be able her mama to pick her up. And my wife came home and said, "You don't understand the magic these people are doing. You have to do this the rest of your life." A question I'm asked often is, not only by patients, but by colleagues and by students, is how do you build a good relationship with your patients? And what you have to realize is you're a team. And you're there for the reward of what you can do for the patients, and they're there just trying to seek something to make their lives better. And a very wise older physician told me once, if you want your patients to like you, they need to believe you like them. And so working with patients, I want to let them know I care about them as a person, not just their symptoms, not just what we can do, but what it actually means in their lives and what are they looking for. One of the important things that we have in anybody's life is figuring out how to recharge and to unwind and so forth. Given my chemistry background, I love to cook. Cooking is just kitchen chemistry, and I love figuring out how to make the next baking good, or really I like cooking out on a smoker and so forth. My wife and I like taking trips that focus on a cooking aspect. Like a place we go routinely is south of Mexico City, where they take you down to the local market and they show you what to buy and how to make what they do traditionally. And I've been there enough that the people there let me go, okay, that was great, now let me kind of fuse this with what I know from Asian and so forth, and to invent in that way, and that recharges me. At Advanced Pain Care, we believe that pain is inevitable, but suffering is optional.